New Delhi goes into lockdown within hours as India reels from a devastating second wave of COVID-19. More than 273,000 new cases have been reported in the day alone. Well, let's take a closer look at this story with Dr. Abhishek Rimal. He is joining us from the International Federation of Red Cross and Red Crescent Societies. Dr. Rimal, India successfully contained its first wave of COVID-19, but it's just all gone wrong this time. What do you see as the biggest reasons for that?
Thank you for having me in the call. As we have seen, India has successfully contained the first wave of COVID-19. But in the second wave, what we have seen as people are entering in the second year of the long COVID-19 pandemic, and they are really sick and tired and following all the public health measures that has been suggested by the governments and other authorities to follow. And they really want to go back to the normal life. And in doing so, they're letting their guards down that could have prevented them from COVID-19. On top of that, we have the virus which is getting smarter as the day passes. We have now 3 variants of concern, and the recent studies do suggest that these variants are 1.5 to 2 times more transmissible than the original strain of SARS coronavirus 2. All these factors do contribute to this large surge of COVID-19 in the second wave.
And tell us what the situation is like in the hardest hit areas.
There are several states in India like Maharashtra, like New Delhi, like Uttar Pradesh, which is hardest hit by COVID-19. The state of Maharashtra alone contributes around 30% of all the cases of COVID-19 in India. What we have been witnessing now is there is a lack of hospitals, hospital beds, ICU, oxygen cylinders, etc. for the COVID-19 patient. And on top of that, we are also seeing the hospital doctors, nurses, etc. are also falling prey to the COVID-19 pandemic. And all of these are adding immense pressure on the already overstretched health system.
What about the rural areas? What kind of unique challenges are they facing?
Rural India is a bit different story when we compare it with the urban settings in India. The healthcare system in the rural India is not as developed as what we are witnessing in several urban cities in India. They have some chronic challenges like there is lack of medical specialists, some of the medical equipments are also lacking, the hospital beds are not enough there. And on top of that, what we are also seeing, there is a weak surveillance system in the rural part of India, as well as lack of testing facilities. We are also need to have a clear vigilance on people now migrating from the urban setting to the rural setting, which can add immense burden on the already weak rural health system in India.
And what would you say needs to be done then to try to contain this outbreak before it spirals even further?
The solution is very simple, in my opinion. We all need to follow the basic public health measure. It is easier said than done, but that is the only way how we can curb this pandemic. We need to wear the mask. We need to wash your hand with soap and water. We need to maintain the physical distance. We need to avoid going to the mass gathering. And when the COVID-19 vaccine becomes available, get your vaccination as well. If we follow all these basic public health measures, that is the only way how we can outsmart the virus.
Absolutely, but in a country as vast as India, how can the government position its communications to convince people to adhere to these stricter COVID-19 measures you've just mentioned?
Definitely, India is a very diverse country, as you have rightly mentioned, but we should not minus the role of communities in such pandemic. They should be the center of our programming when we try to disseminate this type of message to the community. We need to work with the community leader, religious leader, and the community health workers to disseminate our messages. The government, together with the humanitarian organization like Red Cross Society, should work with their community to disseminate the message. We are all on top of the role of communities. We also are living in the world of social media. One of the lessons learned from the COVID-19 pandemic is the only thing that have traveled faster than the virus is the misinformation regarding the COVID-19 itself. So we need also to work with the social media community to really disseminate right messages through the right channel to the right people, and also put community at the center, their perception, etc. And that is the only way when we can successfully do some behavior change on people on continuing the basic healthcare messaging.
Dr. Abhishek Rimal from the International Federation of Red Cross and Red Crescent Societies, we thank you for your thoughts and time.